Welcome to the fifth episode of the AI Healthcare Podcast. I'm your host, Reid, and today we are joined with my friend Jonathan Sachs, who is the CEO of WUWTA. Thank you for your time, Jonathan. Really appreciate it.
Absolutely, Dylan. Thanks for having me.
Of course. And what is WUWTA and why was the organization started?
Yeah, WUWTA is a patient experience platform. And actually, our mission is we help trusted professionals build trusted relationships at scale. So, what we do is from the moment a referral is made all the way through to an online review, we help the doctors hold patients' hands throughout their entire customer journey. And the way that that looks is patients receive via text message a video that's pre recorded by the physician that describes the stage that they're in, what they need to do to prepare for that stage, and then how to transition to the next stage as well. So we work primarily right now with oral surgeons and plastic surgeons, and we're expanding into various other areas as well.
Okay, awesome. And are y'all mainly kind of in the DC area? Or are you kind of all over the country?
Our practices are all over the country. I'm based in the Baltimore area. The company is based remote and all over the country, and also in San Francisco, where we have an office and a studio.
Okay. Awesome. So you guys are kind of touch all four corners of the country.
Yes. I was in San Francisco at our headquarters last week, and I'm still readjusting to the time zone. But I generally operate in all four time zones right now.
Yeah, I've went.
Actually, more than that, we have customers actually in Australia and in Hawaii. So it's been interesting.
Oh wow, it's crazy, kind of keeping track of all those time zones. Yeah, but yeah, so the goal of WUWTA is to enhance kind of what you were saying, the patient-physician relationship. Uh, how does the referral process kind of play um, in relation to the WUWTA technology?
Yeah, so this is key. This is a place where there's a lot of actually dissatisfaction in healthcare is really the handoffs between your primary care provider and your specialists when it comes to your care. So usually there's urgency to that meeting. So think about an instance where you learn something from your primary care physician and they refer you to a cardiologist. That's a visit you're going to want to have quickly. And right now, the way it primarily works is via paper. So the doctor will write down on usually on a prescription pad the name and number of the physician specialist that you should go and see. And in that transition, there's a lot of confusion. And really, that's because it puts the onus and the responsibility on the patient to go out and to find everything they need to know about their care. Patients are usually by no means experts in what they need from a physical standpoint. That's why they're going to see a doctor and then ultimately a specialist. So that referral on paper puts the onus on the patient to then go in, make an appointment, get in touch with their provider, and manage every aspect of that really all on their own. So the question is, how do you introduce digital tools to
Mhm.
make the referral significantly easier from the patient perspective? And there's a lot of important reasons for that, not only clinical reasons, but also business reasons for the physician to be able to intake that patient as well. Most of these specialists do a large portion of their business from referrals,
Mhm.
and where they get patients is really not marketing, but really referrals from primary care or general physicians. So, what we do at WUWTA that's unique is we have created a way to capture that referral digitally before the patient actually ever leaves the primary care physician's office or the general physician's office. So, before they actually depart that visit, they get a video from the specialist that welcomes them to that practice and guides them through every step along the way, including scheduling, preparing for their consult, pre-surgical instructions, post-discharge instructions, all the way through to prompting them to give an online review. So it's really taking a process that was very manual and very analog and
Mhm.
transitioning it into the 21st century.
Okay. Wow. And you brought up an interesting point too, as well. And kind of one of the things I really think of is, what, and I don't know the statistics on it, but kind of with that interaction from your primary care practitioner to the specialist, have what ends up happening if that specialist turns out to be the wrong specialist for kind of what you're seeking treatment for.
Then the patient's going to ping pong back and forth. And that's not uncommon. In fact, even if it's the specialist that the patient needs to go see, there's still a lot of that communication that sends the patient back and forth managing their own care. Really, in any other industry, it would be unacceptable. But for some reason in healthcare, we've learned to live with it. It's one of
Mhm.
the things that I'm very passionate about with my background, having been a chief experience officer, vice president of experience transformation for large hospital systems, is really working on that. It's helping patients get the sort of service and care that they
Mhm.
require and deserve when they're in a medical setting.
Mhm.
So there's a lot of work to do in that regard. The communication is often lacking, and just problems in a patient referral again by not really helping a patient who doesn't speak the language of healthcare get through the stages of their care puts a lot at risk. The biggest thing is delays and confusion that could lead to a diagnosis after sort of the ideal point of treatment for their disease.
Okay, wow. And kind of from kind of the technology with what a from both a patient and physician standpoint, what has been the overall feedback that the organization has received?
Yeah, so I'll tell you actually, I'll start with my story of how I came to see WUWTA because I think it will answer your question. I was chief experience officer for Robert Wood Johnson University Hospital, and the
Mm,
founder of the company, whose name is Jock Putney, came to talk to me about adopting the technology. And the issues that I've seen during my time in healthcare have basically been if you think about a patient journey, it happens in four stages. The first stage is a patient's identifying that they need some kind of care. So I need to get this test, I need to get this image, I need to go see a specialist. The second stage is they actually have to go and access that care. So they have to get scheduled, they have to be able to get into the office, they have to be able to navigate and wayfind their way to the actual provider. The third stage is where they receive care at the bedside. That's meeting with the providers, getting their procedure, getting surgery, getting their image. And then the fourth stage is what happens after that care experience and how they maintain their health and wellness after that. And what I saw time and time again is healthcare focuses almost exclusively on stage three, provider based healthcare. What do we do at the bedside to ensure that we have the best quality and experience that we can? And what it misses is really the fact that the patient judges that question, whether their experience was clinically excellent, on what happens throughout their journey, not just what happens at stage three.
mhm,
So I saw what is technology. And I think to really sort of solve this problem at the root cause that I just mentioned, you really have to fundamentally change some aspects of healthcare. So, healthcare right now is really not built around the patient. It's really built around the physician and the insurance companies, is what I've seen.
mhm,
So, how do you make it build around the patient? Well, there's a lot of systemic things that you've got to change. And that in healthcare is decades long journey. It could be 20 years, it could be 30 years, it could be 40 years to actually make those kinds of changes and move that big monolith of an industry that's so highly regulated along.
mhm,
What does technology represents an opportunity to make a difference in the entire patient journey right now? And what I saw when I was a chief experience officer is patients really want one thing more than anything else. And it's not the quality of the food, it's not the aesthetic of the building, it's time with their provider. And it's
mm,
evidence that the provider cares about them, wants them to get healthy, and spends time with them. The provider, in a way, is kind of, from a business standpoint, like their own brand. And the
mhm,
patient wants to interact with that brand, with that specialist, with that person. And that relationship isn't always as clean as it should be and as the patients want. So by
mhm,
having these asynchronous videos, these pre-done videos of the physician, it allows the patient and the physician to start building a relationship before they see each other in the office. And that's such a crucial piece when it comes to patient experience that's missing. And WUWTA solves that in this beautifully elegant way. So I have to
mhm,
give a lot of credit to Jock Putney and Jeff Thompson, who are the two founders, for seeing and investing in a platform that really solves really the biggest problems that I see right now from a patient experience standpoint in healthcare.
mm,
So, as coming in as CEO, I asked to speak to some of our customers and figured out what they said about our platform as well. And I'll tell you what they said. They said, "We worried that we'd be sending too much content to patients, but patients love it. That our job every time that we see a patient was to explain to them the same, script that we explain to them every single time. So I'd go into one meeting and I'd be giving the script, and I go into meeting two and I'd be giving the script saying the same thing over and over again. WUWTA cut that out by about 80%. So patients come to their appointment ready to go. And what
Mhm.
patients say is, hey, you're that doctor from the video. You're that guy or that woman from the video.
Mhm.
Um, Thank you so much. Here are my detailed questions. Here's questions about my case, unique to me, not the sort of generic questions that they were usually handling. So they said not only is their day better, but they capture more referrals, which drives volume to their practice, which helps them from a business standpoint. And they also say the patients just love it. And when we look at online reviews of those practices, if you go
Mhm.
up to Google and read their reviews, you see patients saying, "I love that I got videos at every step from the doctor."
Mhm.
And when we talk to to the patients who see our clients, our doctors, they rave about it as well. It's this really unique, engaging way of getting care that they probably haven't experienced anywhere else. So the reception has been very positive to our technology. I don't think people find it to be invasive. It's really welcomed change in an
Mhm.
industry that is often very slow to change.
And and it's interesting, kind of with how you're describing what is technology. Because it seems like the big push in healthcare now is kind of the slow death of kind of the private physician practices, and it's being bought up by all of these big hospitals. Like prime example, my parents live in Florida, and we live right across the street from a big hospital system, and a lot of those physicians are now employed by the hospital. Kind of, what are you? How does the how does that kind of business environment, is what is technology impacted by it, or is it totally separate, or?
Yeah, it's really separate. I mean, I see if I was an executive of one of those large hospital systems, I would see WUWTA as a very easy to implement differentiator that our
Mhm.
patients want. So we work with practices and providers of all shapes and sizes. So
Mhm.
it hasn't been limiting for us. I'll tell you one of my dreams with the company, because this to me represents a huge opportunity. So for all of your listeners, if you're affiliated with a value-based care organization, call me, because this is what I'm going to say for you. Um, Really, I think that represents the biggest opportunity with WUWTA is the transition from healthcare, the transition from sick care to healthcare, also known as the quadruple aim. How do we lower costs, improve the wellness of populations, and improve their patient experience all at the same time? And value based care is a key strategy to doing that. And I can tell you, both of my parents were diagnosed with a chronic disease. They were both diagnosed with diabetes. And their experience was basically like, okay, you have diabetes, go take
Mhm.
this course, take this medicine. And if something goes terribly wrong, call me. And I was like, that's not right. How do we get them the education they need to manage this chronic disease? And I can tell you, having been at healthcare, there are basically five chronic diseases that are attributable to 80% of the costs in the healthcare system in the United States. So if you can manage those, and the Center for Medicare and Medicaid Services has gotten wise to this, if you can manage those, you can really make a huge change in the cost of care across the entire hospital system.
Mhm.
But the key to that, in my point of view, is patient experience and patient education. How do you do that extremely well? And that's where WUWTA comes in, where in that example I just gave around a diabetes diagnosis, with WUWTA, you could get a message every week from your physician that
Mhm.
says, hey, I just want to remind you this week to do X, Y, and Z. Hey, if your A1C number goes above, this limit, I want you to call me. Remember to check your blood every day. Here's a recipe of something that you could cook that would be friendly to your diet and also be tasty. That's where we need to go for
Mhm.
those chronic diseases, is to have very early and very frequent education and interventions with that population. And WUWTA is the perfect platform to do that. It
Mhm.
goes beyond remote patient monitoring and goes into actual sort of education, hearts and minds of people, connecting them with their physician, forming that relationship. And so they get the psychological benefits of that, including not wanting to let their physician down when they
Mhm.
see them the next time, and maintain and keeping their instructions. So I really think that shift that you just described hasn't been a big issue for us at WUWTA. To me, the opportunity that we could really help massively is in the
Mhm.
value based environment, and we'd love to have a partner in that space. to start to test the differences between patients who get regular WUWTA messages and patients who don't.
Mhm. And it's very interesting, kind of reading about what is technology is that, um, you know, it's the first time I've seen it. Y'all are HIPAA compliant. So how are y'all HIPAA compliant in this, you know, kind of crazy environment with we're in about data, and when people say data, they're all like they start screaming at the top of their lungs.
So the key is really to just understand what kind of data you need and what PHI you really need, and then how to create security around that. As so many organizations and us as well have transitioned to the cloud, it's gotten easier.
Hmm.
For us, I would say that the tricky part is the opt-in to receive messages component, and we've had to do a lot of work on that. Our open rates on those messages are above 90% in most of our practices, which honestly is pretty unheard of when it comes to open rates for anything. What
Hmm.
we do is, as we implement the product with practices, we implement a scripting um, education that we've developed that works really, really well to get that high open rate that we have with those practices. So, the hardest thing that we've experienced from a HIPAA compliance standpoint is that opt in. And what we do is we help the patient opt in um, and get them on the road to receiving those messages. Once we have that, we're in very good shape. The patients love to interact, but that's
Hmm.
been the hardest part. Again, the rest is on the cloud, so it's been a little simpler.
Hmm.
Um, and we obviously dealing with some form of PHI. We take our HIPAA requirements very seriously,
Hmm.
but for the most part, it's been smooth. It's just been creativity around the opt-ins that we've had to navigate.
Oh, wow. And kind of where do you see the role of AI in healthcare, um, in relation to kind of the medical referral process in the near future?
Yeah, I actually think that there's a reality where the whole process uh, can be helped and automated using AI. We've been experimenting with a variety of different use cases for certain different types of generative AI,
Hmm.
especially conversational AI. And from the technology that I've seen and having managed practices myself in the past, I think there's a lot of the sort of non-human administrative front desk responsibilities that AI will be able to take over. I think AI's got a massive future in call centers, so stage 2 accessing care. I think there's a lot that AI can do. And the exciting thing to me about AI is the ability of that technology to bring together multiple systems that
Hmm.
integrating them via an API is can be clunky. Um,
Hmm.
it's not in all cases, but when you're navigating 4 or 5 different systems, it can be really hard. I was on the phone with a client last week, and they were sharing with me how they had multiple systems that used to do a piece of what we do. And these are like 5 or 6 systems that they've got jerry-rigged together, using duct tape and glue to make it work.
Sounds like
And I
legacy systems.
Yes. Yeah, I mean, it's a lot of them, and it's a lot of expensive legacy systems that are not interoperable, which is a massive problem in healthcare, one that used to drive me crazy when I led digital health and innovation. Um, and I can tell you that I think AI is gonna do a lot to solve that problem. Um, I worked with AI starting in 2017, so early days around the opportunities with AI. We were in conversations with one vendor that their algorithm functioned like a person in this regard. To get your systems to work together, you just gave logins to the AI as if they were a member of your team that you were onboarding. At that point, they had to the algorithm had to do its work in batches, which was a
Hmm.
problem for what we were trying to accomplish with our specific use. Today, that's not a problem at all. So I think a lot of the conversational aspects around accessing care, I think a good portion of billing, so stage 4, what happens post care, I think a lot of that AI tools can be massively beneficial to increasing patient experience and decreasing costs. And
Mhm.
I could see a lot of new companies coming into that space to work on that. Now, the question to me is going to be, what is going to be the catalyst for change in the industry to make that happen? And as I'm sure you've been reading, Dylan, because I know you're up on this, hospital systems have been suffering massively financially over the last couple of years, basically since the CARES Act funding has gone away from Congress. It's been extremely, extremely expensive to operate hospitals. Reimbursement has not kept up with labor shortages and economics, specifically around the labor component, which is huge in healthcare.
Mhm.
Um, so I think anywhere where AI can help to ease some of that pain for the hospital systems, that's what's going to be the catalyst for them to change. Otherwise, I think, we'll be having conversations about AI in other industries and implementation and use cases there, and then we'll have them in healthcare 20 years from now. So
Mhm.
I think the timing around AI opportunities right now is actually really good to get healthcare to adopt faster than they would have. We're still probably talking a decade plus, and
Mhm.
there's going to be winners and losers. I think that the early movers on this are going to have a massive advantage,
Mhm.
um, definitely in the short term.
Mhm.
But it's going to be fascinating to see where it comes in and the different use cases around it. But I think that there's plenty of them. We're using plenty of them in our product to really help maximize time that patients have with the provider and help to reduce overall costs of care in the system.
Mm. Awesome. And my last question that I do have for you, Jonathan, is what is one particular thing, kind of from a policy standpoint, that you want Congress to really understand about the medical referral process?
Yeah. I think that it's important for Congress to understand just how much money in the system gets lost in that transition. How many patients who should receive preventative care don't, because the system is not designed around helping them to get it in the most simple and easy way possible.
Hmm.
Like again, any other business would design around the customer, and in healthcare, there are just so many customers that it's hard to do that. It's not like a shoe store where you can go in and give $50 for a pair of shoes and walk out with them. The analogy in healthcare would be you give somebody like $7 and then you take the shoes with you, and then somebody pays some portion of it later, depending on how big of a shoe store you are and other factors. So I think Congress needs to understand how important it is, um, and how much opportunity is in this space just from a cost standpoint, because healthcare costs are not going down as a result of the economics that I just shared. I know that's something that Congress is paying attention to, particularly through CMS and CMS programs like the CMMI, the Center for Innovation. So I think that's key. Can I also weigh in a little bit on AI in Congress? I know that was like a point as well
Of
that
course.
I know you're interested in, Dylan. Okay. Um, I think the biggest problem with AI at this point is the hallucinations of AI and the possibility of being able to for bad guys to use AI for nefarious purposes, primarily in not disclosing what is AI and what is real. If you look at what can be developed through Midjourney, through video, it is it is getting hard, and it's going to get harder to be able to distinguish what's real and what's not. These are more than your camera effects and special effects that happen in movies. This is much bigger than that, and we're using a lot of the technology in WUWTA and have been extremely careful and responsible. I'm proud of what we've been doing.
Hmm.
Extremely careful and responsible to disclose what is AI, and we're using it to the ultimate end user, to the patients.
Hmm.
So I think that kind of disclosure needs to be regulated, if nothing else. At the very most basic bare level, that is
Hmm.
the lowest hanging fruit, in my opinion, for Congress to act on, and they should act on it sooner rather than later.
Hmm. Now, tomorrow the White House is going to be releasing their executive order on AI. Do you want to, take any bets on kind of what you think is going to be in it, what shouldn't be in it, what should be in it?
Dylan, I started my career in government relations as a lobbyist. And I can tell you, taking bets on that is not an activity that I'm interested in getting involved in. It will be sausage. Like that's what it always is. Even though this is an executive process, not a legislative process, the technology is so new. There are going to be some
Mhm.
things in it that are going to surprise us, and there are going to be some things in it that are going to disappoint us. Um, so no, I won't take that in, but I know that you're following it very closely, and we'll be probably reading it tomorrow and then chatting about it, the two of us, at some point this week.
Of course. And where can people learn more about you, Jonathan, or WUWTA?
Yeah, please. So our website is getwutta.com, GETWUWTA.com. I am very active on LinkedIn. You can find my profile. I'm just LinkedIn slash Sachs dash Jonathan, SACHS dash JONATHAN, and would love to engage with you there. I look at it every day. I try to post at least multiple times a week, and I would love to continue the discussion with you around patient experience, value based care, AI, digital tech, all of it. So if you're interested in that, please get in touch. I'd love to hear from you.
Awesome. Thank you again. Do not forget to hit the like button and subscribe to my YouTube channel. Podcast episodes are also available on Spotify and Apple Podcast. And do not forget to check out my newsletter on LinkedIn, the AI Healthcare Report. This is Dylan Reid signing off. Thank you so much for your time, Jonathan. Really appreciate it.
Thank you, Dylan.